stress and the heart. Stress can cause heart diseases, and stress can aggravate already exist cardiac condition or heart diseases. So the most common heart disease that is caused by stress is called the broken heart syndrome. Everybody talks about it. It's purely related to stress. Now, the trigger is variable between patients. 90% of the patient with what we call a broken heart syndrome or stress-related cardiomyopathy are females. This condition was discovered in 1990 in Japan. The disease have a Japanese name. We use it even in the United States called Takotsubo cardiomyopathy, and that is purely related to stress. Those patients usually have chest pain or shortness of breath, present to the hospitals, and the only thing we find is really weakness of the heart that is related to what we discover eventually a stressful event that caused it. And the patient need to be treated for that. This is not a benign condition. And most of the patient shows full recovery eventually. Stress also can aggravate an underlying heart condition. For example, patient with coronary artery disease, blockages in their arteries, if they are under stressful situation, sometimes they start having chest pain. Patients with high blood pressure, diabetes, those conditions will be aggravated and worsened with a stressful situation. So we see sometimes, and we realize it even in our daily life, that our blood pressure will increase if we are under stress. Whatever we as a human identify as a stressful situation for me might not be stressful for somebody else. So the moment somebody in so-called stressful situation, to them, their blood pressure increase, so they are in blood pressure management, they realize that blood pressure is, or hypertension is not well controlled. Same for diabetes. This is the stress of effect on the heart in general. Stress by itself can cause other conditions in the body. We have people develop some kind of allergy on their skin. You have people develop stressful peptic ulcer disease, headache, sometimes even in the heart palpitation or irregular heart rate, fast heart rate, without having an underlying any cardiac conditions. Even if we think stress is part of our life, it's still a stress. So people will say, I have a stressful job. I've been doing it for 10 years, 15 years. I'm used to it. The fact is, stress continues to be a stress, even if you've been dealing with it for 10 years. And that will have an effect on the body, even if we don't recognize it immediately. Stress can be at home, it can be at work, it can be anywhere. And sometimes it takes some time to identify the stressful situation. Unfortunately, it's not that obvious. And what we say always, if you have a stress and that stress is causing a problem to your heart and your body, you have to do something about it. The first thing is really try to remove that stress if possible. At the same time, believe it or not, exercise will make the stress better. So if you are under stress, try to exercise regularly. You will feel better after that. Sometimes we have to have family support system, friends around us to help us deal with the stress. Sometimes we need to seek a professional help from psychiatrists, psychologists to help us deal with the stress. Some people, unfortunately, will require some medication to deal with it. They might end up with some anxiety disorders. And even some people who are diagnosed with depression and anxiety, their condition will be aggravated under stressful conditions. So we'll go back to the heart. Putting everything together, stress is not healthy for the heart. It can trigger a heart disease. It can worsen a cardiac condition already there. Patients who are on medication for example, rate control, or their heart is fast, we give them medication. If they are under stress, they realize their heart rate goes up again. So it is very important to manage stress in our daily life. It is not a benign condition, and it can lead to further deterioration of health in everybody. So unfortunately, we were thrown into condition of isolation because of COVID to prevent spread of the infection and decrease rate of death of the disease. it made us isolated. So our social life, and a lot of people rely on that, have been trimmed significantly to minimum, to some people to none. So people try to alleviate this stress by doing multiple activities. Some could exercise, and unfortunately some people relied on gyms. They couldn't go to the gym because of it. And unfortunately we've seen people relying on smoking, either increase smoking, start smoking, and also we've seen people relying on alcohol to alleviate stress as a sedative, and that created a major problem. So we'll go back to the basics. We have a stressful condition. We try to alleviate it by exercise, by increase our social support. I know we cannot sometimes meet people, but with the new technology, with smartphones, smart devices, we always can communicate people. That's extremely helpful. We also can see psychologists if we have to, especially people already on medication for depression. COVID did not help. But we have to be active when it comes to solve our stress, because what COVID created beside the disease itself is really the isolation and the condition we found ourselves in. So social support is extremely helpful under these circumstances. Really, the most important idea I want to stress on here is stress is not benign.